All right, so this is going to be on chapter 7, which is the actual skeletal system. So the last lecture was on bones and bone tissue and how does bone grow and what is bone made of. This is going to focus on just the pieces of the skeletal system, so more than just the anatomy of the skeletal system. I'm going to let you know what exact bones you need to know, since there is going to be 4 chapters and a lot of material for this content week. So I will really deduce down what you need to know. First, you do need to know the difference between the axial skeleton and the appendicular skeleton. So if you can remember what's in the axial skeleton, which is the central supporting axis, things like skull, ribs, and vertebral column, everything else is the appendicular skeleton. So if you just remember one, and it's not one of those, then it has to be part of the appendicular skeleton, but you do need to know that. Remember, there's 206 bones in the body. In this picture, which is on page 95 in your book, the green area is the appendicular skeleton, and everything else is the axial skeleton. So take a minute to kind of look at that and notice what makes up each section of the skeleton. I'm not going to, ask you huge specifics on that, but like I said, if you do know what the axial skeleton is and I ask you what the femur is part of, you'll be able to tell me because you'll know what the axial skeleton is. So let's start with the skull or the cranium. I don't really want you to memorize all these pieces. We'll again talk about this in the nervous system, but just a good idea to start looking this over. There is a lot of pieces. So the frontal bone, the front, the forehead, hopefully that makes sense. We have the parietal bone, which makes up the most of it. The occipital bone, the temporal bone makes up a whole bunch of pieces around our ear. Okay, and then we have the ethmoid bone and the symphysioid bone there in the front. The facial bones, I do want you to know a couple of these facial bones. So you need to know the maxilla and the mandible. Okay, so the maxilla there creates the roof of the mouth and the undersection of the nasal cavity. It forms to meet the upper jaw. It connects to a whole bunch of the rest of the facial bones as well. Certainly the nasal bone you can see there, the lacrimal bone, the inferior nasal, the vomer, the zygomatic bone, all of that kind of connects to the maxilla. The mandible really is the jaw, and it's the largest and strongest bone of the face, and it's really the only facial bone that can move. So a couple of differentiating factors for the mandible. We have the paranasal sinuses. I'm not going to ask you to memorize any of these, but make sure you know what sinuses are. Right? Sinuses are opened canals. They open into the internal nose. They lighten the skull and act as resonators for sound productions. They do have some purposes. This is what happens when we get a sinus infection. These cavities become filled with liquid, and that's why a lot of people get that sinus pain or pressure around their nose, their forehead, or their eyes. So we can see where the sinus cavities are. And all of this is connected with our ears, our nasal cavities. So we can very easily get ear infections, sinus infections. Most often they're associated with an upper respiratory infection. So that infection comes up, it's in the nasal cavity, it spreads to the sinuses, and then spreads to the ears. So that's why we can get such a widespread infectious process in the face. You do need to know pretty much all the sections of the vertebral column. So we have 5 different sections actually that make up the vertebral column. Their job really is to hold the head and torso upright, serves as an attachment point for the legs, encases the spinal cord and protects it, which is very, very important. It allows the body to bend forward, backward, and sideways. So lots of functions of this vertebral column, and it's very important to us. The 5 main sections, we have the cervical vertebrae here. So we have 7 vertebrae there, 12 thoracic vertebrae, 5 lumbar vertebrae. Then we have the sacrum here, the sacral vertebrae. It's 5 fused vertebrae, and then the coccyx is 4 fused vertebrae. We don't talk about the coccyx very much in regards to the spinal cord because it's right at the end there. But the coccyx actually is an important structure that can produce a lot of pressure on the backside along with the sacrum, and we're going to see a high risk for bed sores here in that area related to those processes. There's also normal curvature of the spine. We have a cervical curve, thoracic curve, lumbar curve, and the sacral curve. And this is a very normal curvature. Your book does show you some examples of abnormal curvatures, and probably in school, most of us were actually tested for scoliosis, where you had to bend over and they felt your back to make sure that it didn't have an abnormal curve, and that it just had these normal curves. Let's talk more in detail about the vertebrae. The piece that I really want you to know is that spinous process there. That's actually the part that you can feel when somebody feels down your back. It actually sticks out. The vertebral foramen is where the spinal cord is, and then the body is actually the weight-bearing part of the vertebrae. So it allows us to stand up and things like that, and the vertebral foramen protects the spinal cord, which is, of course, very important. This is like a general structure of a vertebrae. They do vary a little bit depending on where they are in the vertebral column, but they almost all have all of these features. We also have intervertebral discs, and what happens is these actually cushion the vertebrae. So they take some of the shock and weight, but sometimes what happens is if we push too much weight or we do something very suddenly, this can actually herniate, so it actually leaks out and starts pushing on the spinal canal, and that's called a herniated disc, and that can be very, very painful for people, and actually can affect their nervous system or feeling in their legs because of the pressure on the spinal cord. So often those are fixed pretty quickly if it's a full herniation, so that people don't lose sensation. We do have a couple specialty vertebrae. We have the atlas and the axis. You do need to know these. Basically, these are the first two cervical vertebrae. And the atlas is a bit different because it doesn't have a body. It consists of a delicate ring and a large vertebral foramen. Depressions on each side of the vertebrae articulate with the bony projections from the occipital bone of the skull. So when the head moves back and forth, such as when nodding yes, the projections rock back and forth in these depressions. So it allows us to have some head movement. The axis actually then has this projection called the dens on it, and that sits or projects into the atlas and allows the head to swivel from side to side. So that's why these are specialty vertebrae, and they're up in our cervical areas to allow us to have specific head movements. Here you can kind of see that happening. See this ligament's kind of holding that in place, and it allows us to kind of go back and forth with our head and side to side with our head. And then this area here still protects our spinal cord coming out of our brain. Sometimes what happens though is if you get a really, really hard blow to the top of the head, it can actually drive this dens into the brainstem and actually can cause death. So sometimes in traumatic accidents, that's what happens and what causes brain death. The thoracic cage, you definitely need to know all about the ribs. You need to know how many numbers of ribs there are. And in terms of the sternum, which is made up of these three sections here, you need to know the xiphoid process. The xiphoid process is related to CPR. So hopefully when you did BLS, you talked a little bit about the xiphoid process, and that's where, close to there is where your hand placement should be. So I want you to know the xiphoid process. It's right there at the bottom of the sternum. This whole thing is the sternum here. Okay. Then we have the ribs, okay? So we have 1 through 7 are considered true ribs. They're actually connected by this hyaline cartilage here to the sternum. So that's why they're considered true ribs. 8, 9, and 10 are attached to cartilage of rib 7. So they kind of come off of rib 7. They're not directly connected there, so that's why they're considered false ribs. And then 11 and 12 down here are considered floating ribs because they're not connected at all. But they still do serve a protective mechanism to the kidneys, because the kidneys sit right there. So they do still serve some purpose, but they're just not connected. So I do want you to know the difference between true ribs, false ribs, and floating ribs. Let's talk about the limbs quickly. The humerus makes up the upper arm. So people say they hit their funny bone. They often hit their elbow, but that's where that term kind of comes from, the humerus. And then we have the radius and the ulna. So you have to figure out how to differentiate the radius and the ulna. The radius is located on the same side as the thumb. So if you can figure out a way to remember that, it's always on the thumb side, and the ulna is on the other side. It is a little bit longer than the radius. It is interesting to note that when we put our palm up, okay, the bones lay next to each other. When we turn the palm down, they actually cross over each other. So it changes kind of the makeup of the arm there a little bit. Oh, I did want to note one other thing here, the chromium process. It's part of the upper shoulder, part of the scapula, and we're going to use that as a site to decipher how to give intramuscular injections into the deltoid muscle up here. So you can actually feel that. It's right at the top, and it's really, really hard there, and that's the acromion process. So you'll want to make sure that you're able to locate that on yourself, and then we'll be able to locate it on our patients. The hand, I want you to know the phalanges and the metacarpals. The carpals make up the wrist, 2 rows of 8 small bones there. Then we have 5 metacarpals and 5 phalanges, okay? The phalanges are kind of broken up here into multiple sections. That's what allows our hands to bend and move, and the metacarpals really make up the palm of the hand. The pelvic girdle, I want you to know the ilium and the sacrum. So we talked about this, the sacral part of the vertebral column a little bit, and here it comes into play again. So this part is the sacrum, and this is really part of the pelvic girdle, okay? The rest of it is really all connected. There's multiple bones here that are fused together to create the pelvic girdle, but I want you to know the ilium because, again, that's part of our kind of where we can feel our hip, and so you might need to use that as placement on some of our patients. And the sacrum, again, is an area that might create a lot of pressure on the backside for our patients, so we'll want to make sure they're definitely not getting pressure ulcers there. The femur is the long bone of the lower body or of the thigh. Okay, it is the longest and strongest bone in the body, so something that differentiates it there. It really fits into the hip bone, which is a ball and socket, and then it goes down into the knee to connect with the lower part of the leg. The tibia and fibula are the 2 lower bones of the lower leg or the calf, okay? The tibia actually is what supports kind of all the weight in the leg. The fibula actually does not support any weight. It just really helps to stabilize the ankle. You can see how it comes down here actually into the ankle. So no weight on this bone here. All the weight goes on the tibia. So just again, a differentiating factor. The patella is the kneecap, okay? And that actually covers the knee and provides some protection for the knee there. The foot and the ankle. So again, phalanges are the toes, just like the fingers, okay? And then the metatarsals are making up the better part of the foot. So I want you to know those 2 different pieces. The tarsals really are making up the ankle. The calcaneus is actually the heel of the foot. And that wraps up the different bones I want you to know. So hopefully you'll highlighted the ones I wanted you to know because those are the ones that certainly will be apt to show up on a test. If not, feel free to listen to the lecture again and go through there and highlight those areas.